Good morning. I'm going to do a nasotracheal suctioning. So the first thing I'm going to do is check the patient's chart, and then I'm going to enter the room, knock on the door, and always introduce myself. Hi, Mr. Johnson. I'm Amy, and I'm going to do a nasotracheal suctioning. So the first thing I'm going to do is wash my hands, then I'll dry them, then I'll apply my gloving on. I'm going to get everything ready and set up before. And so first thing I'm also gonna do, so since it's a nasotracheal suctioning, I'm gonna place like a gown on also and a face mask just in case if something splashes up when I take out the suctioning. So I'm gonna get my tray ready before I begin. So here I have the lubricating jelly. So I'm gonna set it either on the lid or on clean gauze. And then also I can put my sterile water into the basin with the catheter to sterilize it. Then I will get my gloves ready to go here. And the first thing too, before you do a nasotracheal suctioning, we'll oxygenate. But first off, I'm gonna put their nasopharyngeal way in. So the way you can tell the good size is you go from the earlobe to the nasal air opening, if it's the right size. So you can locate it and place it in, and it should go in pretty easily. So once you're in there, then you can oxygenate the patient. So I'll put a non-refrigerator mask here on. And as always with this, you always need to make sure the bag inflates. Before placing it onto the patient. And then you can always, thing too is always get the vital signs before and after every treatment. So when I am ready, I'm gonna get my suctioning ready. So the thing I would do is I'd set this tubing together, connect it to my catcher here. This is gonna be my catcher for the thing. And then here, I need to make sure this tubing is not kinked or anything. So I'd unravel it and make sure it's not kinked. That way it gets a good suctioning. And then I will turn it on to regulate. So I would have it at negative 120 to 150. And you can always occlude the hole to see where you're gonna be at. So there we go, that should be good. All right, and then once I'm ready, then I will get my other gloves on. You're supposed to place them over top of your other ones. Keeping one of your hands the sterile hand and the other one to be able to grab anything with it, okay? So I'm going to take my one hand to grab the catheter. What I'm going to do is I'm going to connect it to my tubing. And when you know you're connecting it correctly, you'll start hearing it like a hissing sound, and you can test it to make sure it's suctioning okay. And so the first thing I'm going to do is suction up some sterile water, make sure it's suctioning properly, and then I'm going to lubricate the end, that way it goes in nice and smooth and it doesn't cause any irritation when it goes in. So I'm going to get some of that lubricant on there. And then I'm going to remove the mask. And then I'm going to slowly go in. And then if you feel, when you get down to the proper place, if you feel resistance, move it up just a little bit and you can begin to suction. And you don't want to be in there more than 15 seconds. And when you're done to take it out, slowly move it out, inch your fingers up. And you can do this a couple times, but no more, not too many times, because you don't want to harm the lungs. And so if you need to do it again, then we would place their oxygen back onto them to hyperinflate their lungs. And when I'm done, I will hyperinflate their lungs, that way they get their lungs back to normal. And when I'm done with this, I can wrap this around like this and remove it with my gloving, just very carefully. And then I can set that here and remove my gloving. I would wash my hands, dry them, and place another pair of gloving on. And then I listen to the patient's lungs after I'm done doing a suctioning treatment. And I always need to make sure the nurses know and the doctor knows that I did a nasotracheal suctioning. And then I'll check the vital signs before I'm done. And when I'm done with my machine, I can shut this off. And when the patient is back to their normal oxygen level and everything is good, I can remove the oxygen. And if they're on an oxygen device, like a supplemental one, then I can place that back on when they are ready. So when I'm done, I would just remove this and shut this off. And then I chart everything on the patient's chart when I'm done, after I have removed anything, disposed of everything that I have may used, and also removing my PPE. And then I can get everything done for the doctor that has ordered it.